have vaccine administration at local churches. And it turns out that the people, in fact, who are receiving the vaccine are not members of that church. They're not necessarily even residents in the community where the church is located.
Deborah Verholden is the director for Flint Health Equity Solutions and a member of Michigan's COVID Task Force on Racial Disparities. Verholden says more demographic data for respective communities is needed to ensure equitable distribution of the COVID-19 vaccine.
And once certain categories get filled, there can be no new doses for people in that category, which will leave room for people in the other categories who have not had an opportunity to now be moved to the front of the line.
We want to make sure that every vaccine dose is distributed equitably.
During a news conference, Lieutenant Governor Garland Gilchrist announced the launch of a new data entry tool, all in an effort to allow providers to improve the submission rate of race data for all vaccines administered by entering it directly into the state system. Gilchrist said the old way of data collection was flawed.
We do not know the race of almost 1 million of the nearly 2 million people who have gotten at least one dose of a vaccine. But we have to address that data problem so that we can understand the shape of this problem.
Verholden agrees, saying better data is the key to equity.
You've got to have a data system in place where people are reporting daily the in-batch information on who's getting the vaccine. And we also need to know who's eligible. And then we can answer the question, are we doing it fairly and equitably?
James Felton, WNEM, TV5.